Hi, Betty Sue?
Hi, hello.
Hi, my name's Lynette Franklin. I'm one of the wound ostomy and continence nurses here at the Emory Wound Ostomy Continence Education Clinic. I'm so glad that you came to get some help.
Thank you so much. I'm really looking forward to getting some relief from this sore.
All right, so what we're going to do today is do a history and physical. So I'm going to talk to you about your wound, and then we're going to look at the wound.
No, you want to see my ulcer?
I do want to see your ulcer, ma'am, but we're going to wait until after I get a little history. I need to look after the whole of you and see what's contributing to your ulcer. So
after
I talked to you. Don't worry, we'll have a look at it.
All right.
All right. So how long have you had this ulcer?
About 7 months. It's about 7 months.
7 months. All right.
Maybe a little bit longer.
Okay. 7 months or a little bit longer. And how old are you?
I'm 58.
58.
Uh-huh.
Okay, great. Tell me, how did you get that ulcer?
Oh, listen, I hit my leg on the side of the table, just the corner of the table. You know how you do sometimes. And it was small. I mean, it was just a little bump, right?
Okay.
And I put a Band-Aid on it. You know, it was a good thing to do. But darn it, the thing kept on getting bigger. So I used a bigger Band-Aid, and I used a little bit of Neosporin. Neosporin's a good thing. And, well, it kept on getting bigger, and so I went to see my doctor. And my doctor didn't know what to do.
Wow.
So he told me to put some gauze on it, and so I've been doing that.
All right. So how long, you said that you started off, you put a little Neosporin, you put a Band-Aid. About how many months did you do that for?
Oh, I don't know, about a month.
Month? All right. And it started getting bigger, and then you saw your primary care doctor. And how often are you changing your dressing a day now?
Oh, boy. About 3 times, maybe sometimes 4 times.
Really?
It gets really wet. I used to like to go to the gym. But this ulcer, I mean, it's nasty. It gets wet all the time, and it's embarrassing. So I've stopped going to the gym. I know I'm a little overweight, but, I was going to the gym. And now I can't go. My doctor tells me I need to lose some weight, but I mean, what? What can you do?
All right. Well, that's important to know that your activities of daily living have changed, and we'll talk about that. So you mentioned that you're a little overweight. How tall are you?
I'm 5'3".
And how much do you weigh?
Well, I guess you measured me today, weighed me today at about 178.
178? Actually, let me look at your chart. It's 173, so a little bit better than you thought.
That's great.
Good. All right, and let me look in your chart here. Your blood pressure is 130/90. Is that about where you are all the time?
I guess so. That's okay though, right?
Well, it's a little bit on the high side, but we'll discuss that also. So
I just came for my leg now.
I know, and you know what? We're going to dress your leg, but part of the thing is your leg is connected to everything, and so we want to make sure that we're looking after your nutrition and the whole you, so that we can heal that leg, because it hasn't been healing for, what did you say, 7 to 9 months?
Yeah.
Yeah, that's a long time, so we need to look at it.
Yeah, it is. It's really annoying.
Good. All right, so I'm going to ask you some questions, and this helps us figure out what else is going on with your body. Have you ever been pregnant?
Oh, yes.
Yeah.
I've got 3 lovely daughters.
Oh, wonderful. And when you had your pregnancies, did you ever have varicose veins or those ropey veins, or?
No, not with the first 2. They were sort of small babies. Last one, she was a big old gal. So yeah, I did. I had some varicose veins, and I had a little bit of swelling in my legs. I mean, they kind of sit down on the bottom part of your pelvis. Yeah,
those babies, right. And especially if it's a big one.
Yeah, she was a big old baby.
Yeah. And have you ever had a history of a blood clot?
Don't think so. It's, well, when I had my baby, my last baby, she's 22 now.
Uh-huh. Long time to think about.
Yeah, yeah. Well, I guess, yeah. Yep. So I guess, yeah, I did get some. I was given some medicine after I had her, and yeah, she was. I don't remember what the medicine was. You know what? It was that rat poison stuff.
Coumadin?
Maybe.
Do you remember? Did that leg swell? Was it for one leg?
Yeah, no, it swelled. It was a left leg, and it swelled, and it was sore. It was red a little bit.
Wow. Okay. And are you still on Coumadin?
Oh no.
You got better?
Yeah.
All right. And is that the same leg that your ulcer's on?
Yes, it is.
All right. Tell me about what you do for a job.
I'm an executive secretary for a law firm. Guy in one of the partners in the law firm, and so darn, they talk, they speak a lot, and they make me, and I write a lot. I have to write an awful lot of their briefs and stuff, and so I'm sitting at my desk for a good bit of the day.
So the majority of it is at your desk. And you said that you're not going to the gym anymore because it was leaking too much, your wound?
Yeah.
And what type of shoes do you wear?
Well, I'm a professional, so I wear high heels, and you know, I have to look good at my job.
Okay, great. Now, have you ever had
And I'm 5'3" as well, so you know.
You need to have a little height.
Have a little bit more height. Yeah.
Yeah. All right. Have you ever had a heart attack?
No.
Or a stroke?
No stroke. No, I pain in my chest every once in a while.
Have you ever gone to your primary care doctor about that?
No, it goes away.
Is it like when you walk upstairs or do activity?
No, usually just kind of sitting around. It's 2 or 3 times a week. No, it just goes away.
Okay.
And so I haven't done anything about it.
Have you ever been told you have high cholesterol?
No.
Or high blood pressure?
No.
All right. Well, let's continue on in my assessment here. What about smoking? Do you smoke?
Well, no, I don't anymore. I used to smoke.
And how much did you smoke?
Well, I guess when I stopped, I had about a pack and a half a day.
Pack and a half a day. And for how many years were you smoking a pack and a half a day?
Well, I don't know. I guess about 15 or so.
All right. And how many years have you been stopped now?
Well, a long time. I stopped when I was pregnant with my last baby.
And then she's 22?
She's 22, yeah.
Okay. And what about any drinking? Do you drink any alcohol?
No. I just, no, I drink beer.
You drink beer. Okay. How much beer do you drink?
Well, usually one. Usually one a day.
One a day, okay.
After sitting at my desk all day long, my leg kind of gets sore. It aches. And so I go home and I put my legs up. I've got a really comfortable recliner, and I get my beer and watch the news. Important to watch the news.
It is important, yeah.
And stay up to date. So, sometimes I have 2, but,
And that's every night?
Yes, often.
Okay. All right. And have you ever been told you have sugar or diabetes?
No, don't think so.
Well, I'm looking here on your medical list, and it says you've been on metformin. Did your doctor talk to you about that?
No, when I went to see him, gosh, it was 6 months or 7 months or so ago. I guess it was, I've had this sore for longer than 7 months then, because I saw him about 7 months ago.
Yeah.
No, he drew some blood, and about a month later, he called and said that he called in a prescription for me. So he called in that Met thing.
The Met thing. And are you taking the Met thing?
Sure, of course.
Okay. And are you doing any finger stick blood sugars or checking your sugar?
No, why would I do that?
Well, metformin is a drug for diabetes.
Oh.
And did he talk to you about your sugar level or hemoglobin A1C or anything like that?
No.
He didn't give you any lab numbers?
Well, he talked, I don't think so, I don't know, he talked about, these doctors, they kind of throw out numbers and they talk so quickly, you don't really know what the heck they're saying a lot of times. He said something about 8.
8? Being too high?
Well, I don't know whether it was too high or whether it was just right. maybe 8.3 or something, or maybe 83.
All right, well, we'll get that information from your primary care doctor. So looking at your medical history, I see you take 1 metformin a day. Do you take any over-the-counter medications?
No, just Tylenol for my pain.
Okay, so you take Tylenol for your pain, anything else for your pain?
The beer helps a little bit.
Okay.
Yeah,
All
it
right.
does. And I take a vitamin pill too. That's a good thing.
A multivitamin?
A multivitamin,
All right.
yeah, I do. I eat well too, though. Well, I probably eat too well, but
Yeah.
okay.
All
All right.
So in terms of your pain that you've mentioned, when you get up in the morning, what's your pain? Say on a scale of 0 being no pain and 10 being the most pain you can imagine, what would your pain be?
Oh, 3 to 4, I guess.
Okay, and
In
at
the
the
morning,
worst,
yeah.
at the morning,
Yeah.
and at the worst part of the day, what is it?
Oh, I don't know, 6, 7, 8. Usually not 8.
Right.
But 6 or 7 or so, yeah. And then the beer helps. The Tylenol does too.
All right, and when is it at the worst?
Oh, yeah, usually when I come home, just before I get into my easy chair.
Okay, in your easy chair, your feet are up.
Yes.
All right, and is one leg ache more than the other?
Yes, the left leg aches more because that's where the sore is, but the right leg aches a little bit too.
All right.
Because they get a little bit, after sitting all day, they kind of get a little bit swollen.
All
Got
right.
fluid in my feet a little bit.
Okay, so what I'm going to get you to do now is just walk down the hall and walk back,
Okay.
and then I'm going to get you on the table to do a physical exam.
All right.
So,
Fair enough.
so I'm now having the patient walk down the hall, walk back. She has high heels on. She has a heel-toe gait. She does not roll her ankles, and she walks securely without any wobbles. On physical exams of her shoes, she has a wear pattern from heel to toe, and there's no, the left is not greater than the right or the right greater than the left, and it's an equal wear pattern. All right, Betty, so I'm going to get you to get up on this table here.
I guess I should take my shoes off, huh?
That would be great.
Probably. Your beds are hard.
We're working on that. All right, so I now have the patient in the supine position for 10 minutes with my magic wand, and now we're going to do the physical assessment. So first of all, I'm going to put the blood pressure cuff on your arms and your legs and get the readings. So for the left upper arm, it's 124. The right upper arm is 122. The dorsalis pedis on the left is 120. On the right is 116. The posterior tibial is 114 on the left and 106 on the right. On physical exam, I check from her toes to her knees. On her left, she has +3 pitting edema, and on the right, she has +2 pitting edema. I'm now going to elevate your legs and look at the color changes. So I'm starting on your left. I lift up your leg and hold it. You don't lose any color. I put it back down. The color regains. Now I'm going to drop it over the side of the table. There's no dependent rubor. I'm now going to do it on the right. Her venous refill time is less than 10 seconds. I'm now going to do for dependent rubor. no evidence of change. Now what I'm going to do is check for position sense. I'm going to hold your great toe. I'm going to get you to close your eyes. I'm going to wiggle your toe and point it towards your head, towards me, to the left, to the right. All right? So I'm going to get
in that order?
Well, not that order, but thank you. That would be tricky. All right. I'm going to start with your left.
All
I've
right.
got your great toe now.
All right, I
Is this
can feel that.
Great. I'm going to just move the camera a little bit so our at-home audience can see what's going on. Whoops. Sorry. All right. I've got your left foot. Thank you. There we go. All right. So tell me what direction it is. All right?
Down,
Okay.
up, left, right, ouch.
Great. Oh, sorry. Now on your other toe.
Up, left,
Good. Sometimes your left and right get confusing, don't they?
right,
Good.
down.
Excellent.
Thank you.
All right. Now in physical exam, I'm looking at your toes, and I notice your toes are well polished.
They are, I know, I got that probably especially for you. I knew I was coming in here.
Really? What color is it?
It's red.
Red? Oh, it's not Midnight Sun? It looks like Midnight Sun. Anywho, I digress. So, do you do your own nails, or do you go to a local spa?
Oh, I go to a local salon.
At the local salon in the mall, or
Oh, so,
in the, okay, sort of in a mall. All right, do you go to a podiatrist?
no.
No. All right, I'm looking at your feet. There's no evidence of hair on your feet. Do you shave your legs?
Of course.
Of course, and how often do you have to shave them?
Once a week.
Once a week. I'm still standing, but I just want to be in the in the video. And how? So you shave your legs once a week.
Yes, I do.
And do you have any problems with cool feet?
No.
No. All right.
My feet stay hot.
Your feet stay hot.
Yes.
Now your big toes have really thick nails. Have they had those for a while?
Well, yeah, a little bit.
Okay. I'm looking on your right and left toe, and your second digit, both of them are a hammer toe. You have a callus on the right dorsal toe and the top of the left number 2 digit. Your left number 5 digit has a callus, and you also have a callus on the tip of your number 2 left digit and on the tips of your number 2 and 3 right digits. All right. Now we're going to have a look at that wound. You can take the dressing off.
All right.
All right, and it's on your left
Yes.
medial malleolus. And I'm going to show you a picture.
Even you see?
That's quite the wound that you have there. I'm going to get you to hold this, and I'll describe the wound, what I see, to the viewers at home.
You're putting your patient to work.
I am. This is her left medial malleolus. When I take off the dressing, the old dressing is saturated with serosanguinous drainage. There is no odor. It is 4 double 4x4s packed onto each other. When did you do this dressing, Betty Sue? This morning? Great. So looking at this ulcer, you can see some redness and purpley brown coloring on the pigmented skin. When I take a 4x4 gauze and wipe it, a lot of this yellow material just wipes right off. The wound edges are open. The measurements from here to here are 12 centimeters. from here to here is 10 centimeters, and the depth is, sorry, I forget what the depth is. It's 2 centimeters.
0.2.
0.2 centimeters, excuse me. So the overall measurements are 12 by 10 by 0.2. When I feel here compared to her other leg, there's no increase in warmth, and there's exudate dripping down as I'm looking at this. We'll show you this picture during the exam. So that's the end of our physical assessment. You're now going to break up into groups of, there'll be 3 groups all together. You each have 10 minutes to discuss the whole case study. This is the only time you'll be able to discuss the case study with your class, within your group. You want to come up with 2 questions. The first question that you want to ask, and then your backup question in case one of the other groups asks your first question. You can ask any questions, and the clinician will address what you didn't have or what you need to complete this case study. There's definitely some material that was left out, and if you have, once we're finished with that, then you'll go home and do your case study, and it's not open for discussion anymore. If you have any questions, just give us a holla, and all the best. You guys will do great. Thank you.